Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
In this video, we will review how to document a home health aide mobile visit on the Axxess Home Health mobile app. When first opening the mobile app, you will need to click the Login button, where you will be taken to a website where you will then enter in your email address, which is associated to your Axxess user. You will then be prompted to enter your password and then click OK. You will then select an agency profile. For security reasons, all first-time users must set a PIN. Please remember this PIN as it will be required when opening the app in the future. You will re-enter your PIN, and then you may see a screen that will ask if you want to enable Touch ID. You will also be provided additional information in regards to the mobile app. You will first land on the home page. For this video, an Android device is being used. Take note that iOS devices will have all of the same features and functionality, but some icons may appear in different locations on the screen. On the home screen, you will have the ability to route your visits and view your electronic ID badge. Below is the navigational toolbar. Begin by navigating to your schedule. On the schedule page, you will see 3 tabs across the top. You can view any past due tasks, as well as any that have been completed, or any that are upcoming, which will include visits for today and in the future. In the event you are in an area with poor cellular service, you have the ability to download your visits for offline documentation. To download your visit, select the blue cloud with the down arrow prior to entering the area with poor service. Once the visit has been downloaded, the cloud will turn green with the check mark indicating you are ready to complete offline documentation. You can also choose to download multiple visits by going to your menu and then click Download Visits. This will download all available visits. Going back to the schedule and then choosing the visit in which you want to document, you will then be taken to a page where you will see the name of the visit, the patient's name. You'll be able to view any visit history. This will include the ability to search for the home health aide care plan. Selecting it will allow you to view the HHA care plan in PDF view, where you can then zoom in to see what was documented. This will help to ensure compliance. Going back, we can navigate to the patient's chart. On the patient's chart, you will be able to take a picture of the patient. You will see the patient's name, their gender, DNR status, their date of birth, and their medical record number. By clicking Info, you will be able to view additional information not seen on this screen. Clicking the Call button will allow for one-touch dialing to quickly call your patient. Clicking the Map button will allow you to use your device's map to map out the route to the patient's home. Key information will include allergies and the patient's diagnosis. Below, based upon your permissions, you will be able to view medications for the patient, orders and care plans, plan of care summary, visit history, physicians, clinical team, contacts, and pharmacy, all of which will allow for one-touch dialing. You will also be able to view any communication notes, the infectious disease profile, immunizations, pre-admission notes, and documents. By choosing documents, not only will you be able to view any documents that have been uploaded for this patient, but you will also have the ability to upload an attachment as a document to the patient's chart. You would select the document type, enter a document name, and then choose a file. You may upload a file by taking a photo. Taking a photo will bypass your device's camera roll, ensuring HIPAA compliance. Or you may choose a photo or file from your mobile device. Going back will then take us to the patient's chart. One more time back will take us to the HHA visit information. We can view orders and care plans. We can also document a COVID-19 screening based upon your organization's policies. Below, you will be able to see any visit comments as well as any episodic comments. You will also have the ability to document a missed visit should you need to. If you are ready to start the electronic visit verification process, you do have to be within 1,500 feet of that patient's home. We will now begin the visit by selecting Start Visit Verification. If you selected this in error, you can cancel the visit verification by clicking on the red Cancel Visit Verification button. Once you have started the visit verification, navigate to the visit note. You will see the different sections of this visit note populate. You can select one visit at a time to open that section, or by selecting the three dots in the corner, you can choose to expand all of the different sections. Also, by clicking on the three dots, you can choose to view the patient's chart or cancel any changes. If your organization utilizes the electronic visit verification process, your visit start time will populate for you. If your organization does not utilize the electronic visit verification process, you will need to enter your start time. You will also have the opportunity to enter any travel time, as well as associated mileage. Areas in gray on the 8th visit will be information that was included when the HHA care plan generated was completed. By scrolling down to the section titled Tasks to Perform, you will see any tasks that were included on the care plan in which you do need to complete, or you may document that the patient refused if applicable. You will go through each section and document your findings. All sections marked with a red circle with an exclamation point will be required fields. For vital signs that are completed, you will be able to enter in your assessment, document any personal care that may have been provided if that was included on the care plan, if the task was indicated to be completed weekly, you will have the ability to choose whether it was completed, refused, or not applicable at this visit. If the case manager was notified of problems or concerns, you can document with a check mark. If any infection precautions were followed, you may then indicate which type of precautions. In the comment section, you will have the ability to utilize your device's microphone and use the talk to text feature. You can also add any coordination note should you need to. You can save the note and come back later to complete your documentation. Once you've completed the visit, you will need to navigate back to the top of the visit to then enter in your end time. Once you have completed the visit and entered your visit end time, you can click Complete Note. You will see a screen that asks for the signature date and the signature time. You can save and exit to complete later, or you can click Complete. Once you click Complete, you will be taken to the visit verification screen. This will show you the patient's address as well as the visit start time and out time, as well as your visit's started location and ended location. By scrolling to the bottom of the page, you will see a button that says Verify Visit. By clicking on Verify Visit, you will then have the patient confirm that the visit was performed, and then they will sign their name. If they are unable to sign, you may choose the Patient Unable to Sign button, which will then allow for a voice recording to be captured or for a caregiver to sign the visit verification. At the bottom, you have the option to clear the signature or verify visit. To confirm signature, you will choose yes. And then as the staff, you will sign your signature. That will then indicate that the visit was completed and the visit has been verified. To view your documentation of the visit, you may choose the visit document. Here you can see the documentation that you completed on your HHA visit. By going back, you can then go to the completed section, and then by finding your visit that you completed, you will then see a green house, as well as you will see the status that says completed for that task. This concludes our video of the documentation of the Home Health Aid mobile visit and the Axxess Home Health mobile application.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.